Your doctor has talked about EVAR to treat an aortic aneurysm. Here is what that actually means. The aorta is the body's main artery. An aneurysm is a weakened, ballooned section of its wall that can grow over time. If the aneurysm keeps growing, the wall can eventually tear. Repair aims to prevent that from ever happening. Vascular societies generally recommend repair when an abdominal aneurysm reaches around 5 centimeters, grows quickly, or causes pain. EVAR means endovascular repair, fixing the aneurysm from inside the artery through small openings in the groin. The surgeon threads a collapsed stent graft up to the aneurysm, then releases it. The fabric tube seals against healthy artery walls above and below. Blood now flows through the graft instead of pressing against the weakened wall. The aneurysm sac often shrinks over time. The procedure usually takes 2 to 4 hours under general or regional anesthesia, guided by live X-ray imaging in a hybrid theater. Most patients stay in hospital 2 to 4 days and walk the day after surgery. Full recovery at home takes a few weeks. Heavy lifting is usually avoided for 4 to 6 weeks. Daily walking, wound care, and gradual activity help healing. EVAR carries risks like bleeding, kidney strain from dye, and endoleaks, small leaks around the graft that need monitoring. Because the aneurysm is not removed, lifelong imaging is needed, usually a scan at 1 month, then yearly checks. Long-term care also means controlling blood pressure, stopping smoking, and looking after the rest of your arteries. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.